now with our panel on COVID-19 and the spread of scientific information. For those of you who are just joining us, my name is Aria Rao. I'm the President and Chief Editorial Officer of the Columbia Undergraduate Science Journal and the President of the National Undergraduate Consortium of Science Journals. I'd like to introduce Isabella Leite, who is the Editor-in-Chief of Columbia Undergraduate Science Journal's undergraduate publication and the moderator for this panel. So Izzy, I'll hand it off to you.
Thank you so much, Aria. So hi, everyone. Thank you for being here, and thank you to our panelists for joining us. I'm sure that we're all really excited to hear your insights about COVID-19 and how it relates to scientific misinformation and communication. So before we start, let me just preface this by saying that we can start off answering questions like in order to make it easier, but if you have any thoughts, please just like jump in and, you know, say what you're thinking. I really hope that this can be more of like a discussion among you guys. To our attendees, please put your questions into the Q&A function at the bottom, and we'll try to get to those at the end during our Q&A session. So with that, panelists, would you like to please introduce yourselves and maybe share some recent work that you guys have done before we start? Maybe starting with Mr. Zimmer.
Oh, sure. My name's Carl Zimmer. I'm a columnist for the New York Times. Before the pandemic, I wrote about lots of different things in biology, but right for the past 9 months, I've pretty much only written about COVID. So I can talk about sort of how we journalists are dealing with this unprecedented challenge in science writing.
Great, thank you. Betsy, I'm just going in the order that I see you guys.
Sure. So I'm Betsy Ladyzhets. I'm a data journalist and science writer. And I kind of have 3 roles now in covering COVID. So I work for a small data journalism publication called Stacker, which makes slideshows based on data and research. And I run the science and health content there. So I've basically been managing our COVID coverage for the past several months. Which is kind of an interesting challenge because as a one-person science journalist, one-person science newsroom, I really have to prioritize and figure out what we're going to cover and how to do that. I also volunteer at the COVID Tracking Project, which for anyone who doesn't know, is a volunteer data source run out of the Atlantic that's compiling information from state dashboards in order to kind of fill in a public health information gap from the federal government. And I also have to kind of disclaim that I don't speak for the project. It's a huge operation. I can just talk about kind of my own experience. And then I also run a newsletter on COVID data, which kind of brings together experience and resources and insights from both of those other 2 positions.
Thank you. Professor Marca? Oh, you're muted.
Oh, yes. So my name is Szabolcs Márka. I'm an astrophysicist in the physics department. I'm interested in the life and death and birth of cosmic black holes. And I'm also interested using my experience with technology to change the world. And we do biophysics, focusing on global health and how we can use technology to make people's life better. So we are, of course, doing everything we can to serve the needs in the COVID emergency. And I think it's very important that we all help out wherever we can.
Cool, sounds really interesting. Yolanda?
Hi, everyone. My name is Yolanda Bachelet-Avico, and I'm the current policy lead for Dr. Party Sabeti, who's a faculty at Harvard and the Harvard T.H. Chan School of Public Health, as well as an institute member and computational geneticist at the Broad Institute. Initially, I do come from a policy and human rights background, but in my current role, I focus on the intersection between science and public health policy. I've also worked in close collaboration with Dr. Sabeti and her collaborators on several technical and policy pieces related to COVID-19. Most recently, there was a piece in STAT on how the mumps epidemic in Massachusetts in 2015 and 2016 has a lot to teach colleges about reopening safely in the time of coronavirus. And I'm honored to be here today among so many distinguished panelists.
Thank you. Professor Schindler?
So my name is Chris Schindler. I teach at Columbia University. I'm in the Department of Microbiology and Immunology as well as medicine. And I teach undergraduates, I teach them immunology. I'm specifically interested in interferons, which many of you probably know play an important role in our innate response towards viral infections.
Awesome. So thank you for the introductions. Let's just jump right in with some questions. So we can keep that same order, but like I said, just feel free to hop in whenever you want to say anything. So with the recent news about Pfizer's vaccine trial success, what are some hurdles that you think will impede vaccine distribution once it's available? In particular, how do you think things like the anti-vax movement and distrust in the government will affect that?
Well, I think we have to wait and see just how big of an impact that's going to be. The anti-vaccine movement does get a lot of attention, but it's easy to forget that actually, vaccination rates in the United States are still quite high, and it's just the problem is that you can get flare-ups of, say, measles when even a small community decides not to go in for vaccination. I honestly think that, I think that as people see that these vaccines work, I actually think that there's going to be a big clamoring for them. On the other hand, so the real issue when you talk about distribution is distribution. It's going to be how are these millions of vaccines going to get to millions or hundreds of millions of people given our poorly maintained health system. And there are lots of plans in place, and we at the Times are reporting on those plans, and enlisting drug companies, planes, or airline companies are fitting out their planes, getting ready to transport crates of vaccines that have to be kept at -94 Fahrenheit and so on. It's a huge infrastructure challenge. I don't know if we're up to that challenge as much as we should be, unfortunately.
So I heard an interview with Albert Bourla, who's the CEO of Pfizer. He claims that Pfizer is very good at shipping out things at cold temperatures, and I'm sure they are. So it's very easy to send something in a box with dry ice to a medical center or a laboratory that's used to getting it. But if you're trying to send it out to an Indian reservation or something like that, or just to some rural area, I worry that that's going to work. And of course, it's not going to work in third world countries.
No.
So
I would also.
Sorry, please go ahead.
Well, thank you. Echoing off of the infrastructure challenge, I would say as a data journalist, I'm concerned about the data infrastructure. We definitely saw with testing that state and local public health departments, in many cases, because of kind of an absence of leadership at the federal level, had very different ways of doing things, very different ways of tracking their testing and their cases, very different ways of even just defining a basic thing as how you report your tests, what units you're using. And I'm concerned that there's going to be something similar with vaccines, where there's not a really well set up national vaccination registry. Some states have them, but there was actually a report that the Kaiser Family Foundation did on this recently, looking at state plans. And they found that just over half of the states say they have immunization registries or databases that are comprehensive and that are ready for COVID vaccines. So what about the rest of the states? What are they doing? How are we going to know what's going on? If we don't know where the vaccines are being used, how are people going to know where to go to get vaccinated? And I think that plays into trust as well, particularly for Americans who feel like their personal liberties are at risk. If they're sharing data, which has been a problem for contact tracing as well. And you say, well, in order to get the vaccine, your name and your demographic information needs to go into a registry. Maybe that might make some people more hesitant. So I think the data infrastructure question is really a concern on many different levels.
Yeah, and I would add to that it's particularly important with these first two vaccines because they are both 2-dose vaccines. So people are going to have to come in, get vaccinated, and then they're going to have to come back in 3 or 4 weeks. So keeping track of who got the shot and have people come back and making sure they come back. And I mean, that is, you're going to need good data. And then more generally, you know, when any vaccine gets rolled out, you know, you have these, you know, initial studies on safety and efficacy in a clinical trial, but vaccines have to continue to be monitored for safety as they go into thousands and millions of people just, you know, outside the trial. And for that, again, you need good data. And if we're not getting, you know, those, you know, records of how millions of people are doing, you know, we might miss some rare but concerning side effect, or we may miss the fact that it's not working as well as we had hoped in one group of people versus another. So yeah, the data is important.
So I worry about um, um, incompetence and regions that are less like us. Yeah, so I travel a lot. I travel to even conflict regions. You know, go through checkpoints where there are gunpoint, and transferring things, especially scientific equipment, is not that easy for significant part of the world. Yeah, it's not that easy to ensure that they arrive intact, and that also, you know, plays into the data tracking role. You have to make sure that whatever arrives is real, it's not fake. Whatever arrives is used as intended. And we are in it everywhere on Earth. Yeah, so it's not like we vaccinate everybody in the United States or Europe and then we are done. No, we have to vaccinate everybody, and we have to make sure that they get the right vaccine and not something else. And I'm really worried about you know, the integrity of the chain and the feedback on the integrity.
I think another big issue here is, do we have an initial coordination and prioritization strategy? So once these vaccines are finally, you know, proven safe and effective and manufactured, do we have a strategy to prioritize at-risk groups first who want the vaccine, and then move to include other groups as well? You know, even with the ongoing allocation of diagnostic tests, which is what the Sabeti lab sort of focuses on in a sense, we still haven't been able to figure that out. So then we have situations where, you know, more privileged folks have more access to diagnostic tests, they have access to asymptomatic testing, while, you know, other less privileged communities are still unable to access, you know, or to meet their clinical testing demands. So this is sort of the same imbalance we want to avoid with rollout of a vaccine. And it should be interesting to see if our leaders are able to develop an effective prioritization strategy.
And there are people in the United States, there are people in Europe who are afraid. You know, refugees, undocumented immigrants, they're afraid. Are they willing to actually stand in line, put their name on it, come back, put their name there? Are they willing to do that when somebody is waiting for them? It's a really big problem.
In some places in the world, medical supplies fall into the purview of the black market very often. So I'm aware, because I've had students from Pakistan where hepatitis is endemic because people reuse syringes because they can't afford to get a new syringe or sterile one. And so I can anticipate this being a huge problem in the third world.
That actually, oh, sorry, I was going to say that segues really nicely into another question that we have. Given the racial and economic disparities of those affected by the pandemic, do you think that aiming scientific information to targeted audiences and age groups can help decrease the spread of misinformation? How can this be done in the context of global health? How can we best disseminate information in a culturally appropriate way?
I think it's important. and there are lots of ways I can think about doing it, but for example, yes, there should be plans to communicate about how these vaccines work and address people's concerns, targeted to Native American communities, to African American communities, to communities in different countries that with real insight about what different communities want to know about and what their concerns are. I completely agree with that and think that's important. I guess as a journalist, it's kind of frustrating that we're in this pandemic at a point where local journalism has been decimated, so that the best channels for good information for communities, local newspapers for particular communities, like African American newspapers, they have been collapsing left and right. So it's going to be harder than it used to be to reach out in the way you're talking about. And it's going to be even harder because the same tools that a journalist or a public health worker might use to reach particular communities, the internet, social media, those can be very easily and powerfully manipulated by someone who wants to spread disinformation, either a vaccine denialist or just someone in Russia who feels like sowing discord in a country. We've actually seen there's plenty of evidence that there have been Russia-based campaigns to spread vaccine disinformation in the United States. Like it's been documented and published, and so I'm very worried that that's going to next month, the month after, we're going to be hit with things like that, and we have to be ready for it. And I'm concerned that we don't have good defenses for it.
So I've heard anecdotally, or perhaps from the mayor of New York City, that having people in communities involved in contact tracing has increased the likelihood that they can successfully contact trace people who are embedded in specific communities. I actually haven't seen the data, but I would think that same approach would work well with disseminating information.
Yeah, I would definitely agree with that and
Has
say
anyone
that
seen data on that?
contact tracing data is really spotty and hard to come by, I think partially because contact tracing itself in the US is very spotty and hard to do. I tried to look at it for a newsletter issue a few weeks back and didn't find very much. But I would definitely agree with you in saying that kind of leadership coming from inside the community rather than some outside government official trying to explain something is a very important part of this. And basic accessibility is also a really important thing in terms of how public health leadership is talking about questions of cases and testing and vaccination and all of this stuff, and what information they're putting out there. Like you look at Governor Cuomo, for example, who does these PowerPoints, and he gets a lot of people watch them, they get a lot of press. And I can't think of very many examples where he's talked about the demographics of the coronavirus in New York State. And if you look on New York's data dashboard and you look for demographic information, they don't even have the demographics of cases. They only have demographics of deaths. And even those numbers are pretty staggering, but it's very incomplete. And a lot of other states, at the federal level, it's very hard to find this kind of information. Some states will bury their demographic data in kind of a weird spot on their dashboard, or you have to do all of this hovering over pie charts. I work on the racial data set at the COVID tracking project. So I spent a lot of time doing this, and it's much harder than it should be just to get the basic information. And I think that kind of sends a message that these communities aren't prioritized when they should be prioritized. So if that can be turned around for vaccines and sort of other issues like this, I think that's a very basic step that should not be hard to take.
I think also, building on some of the points that have been made, the message that is coming out is just as important as who is bringing that message to these communities. So are we actually consulting enough with BIPOC doctors and scientists, as well as minority-led organizations that actually have perspective into the needs and preferences of these communities that we're trying to reach? Are we elevating BIPOC scientists and doctors to leadership roles within national health agencies and organizations? Are we paving a path for more students of color to pursue careers in, science and medicine? So I think, if we truly want to combat the spread of misinformation in vulnerable communities, we have to start implementing systemic changes from the top to actually help rebuild trust and actually leverage the expertise and perspectives of those same communities.
I don't see a big difference between this question for mosquito nets or other life-saving things what you distribute. Yeah, you have to have trust from the users. You have to trust from the local community, and it can't be dictated. That trust must be earned, and if the trust is not there, it's in vain. Yeah, it was proven over and over again. So it must be. It's not just science. It's sociology. You have to care about the people.
Okay, so if no one has anything else to add, we can move on to the next question. Many Americans feel that mask mandates and stay-at-home orders infringe on their rights. At the same time, other countries such as South Korea and Italy have implemented stricter rules than we have. Is this sentiment common internationally, or is it unique to Americans? And if so, why? For those of you that are familiar with the global context of the pandemic.
So I think Americans have always romanticized the individual cowboy or making a life out of the land, and we still romanticize it. We don't as much romanticize cultural life in the city. So I was actually born overseas, and there people romanticize culture, cities, history, and we don't tend to do that in this country.
I also think the individualistic nature that Americans have plays into a lot more than just coronavirus issues. Like if you think about climate change, for example, and how many people here, including a lot of people in government, are hesitant to tackle that. It's really this sense of, well, maybe this issue will not affect me personally, and I'm just taking care of myself. So I don't need to worry about what everyone else is doing. I don't need to act for a broader community. And I think that's a question, whether you're asking people to stay home and not travel for Thanksgiving, or whether you're asking people to, say, pass the Green New Deal. And it's come up also in the context of all the social issues, demographic issues that have been raised by the pandemic and sort of been thrown into starker relief by the pandemic of like, is our healthcare system working for everyone? Clearly it's not. What do we need to do about that? And for a lot of people, it's hard to sort of flip that switch and worry about that broader context because they think, well, I'm fine, so nothing needs to change. And I think that's something that, at least in my view, I think that science communicators need to work harder to push back against and to, explain why it is important to care about that broader context.
So I just came back from Europe and I observed something I don't like. Yeah? So people treated COVID like they would treat radioactivity. I don't see it, so it doesn't hurt. So people did not wear masks because obviously nobody is sick. You don't see the sick people. So actually, I see more mask use in New York than I had seen in Europe. So I think it's more general than we believe.
I also think one of the unique challenges in the United States, which I'm sure other countries have as well, but what I have more perspective into is the issue here is that we have this sort of politicization of the mask issue, and they're looking at masks as a partisan issue rather than an issue of personal health and safety. So Dr. Sabetti always repeats this common phrase that outbreaks only exacerbate and exploit the existing divides in societies. So one of them being the political divide is a very big issue these days. So I think it's a question of, on one side, you have people who feel that mask mandates infringe on their personal liberties. And on the other side, you have people who feel that for the collective good, masks are critical in containing the virus. And we understand that science actually backs up the latter view. So it's really, what personal liberties are we valuing most here? Are we valuing the right to life, or are we valuing, the right to ignore necessary health mandates?
I think that something I've been wondering is whether masks became such a flashpoint in the United States because the United States has failed with so many other efforts to rein in the virus. So if you look at a place like South Korea, for example, they hit the ground, they had the first cases as we did on the same day. And then they rolled out an entirely profoundly different kind of strategy, in the sense that, like, they had a test that worked right away. They made arrangements to have lots of testing in place. They had really aggressive contact tracing. They were serious about PPE in their hospitals. And we have done a really lousy job on all those fronts. And so, I mean, if there was like really widespread testing, even sort of, relatively simple tests, but tests that were done frequently, maybe on half the population, once or twice a week, followed up with really good, contact tracing public health efforts, we could really take a serious bite out of this huge surge that we've got. But we just, as a society, and maybe led, by the administration, we just haven't been interested in that. So now, what have we got? We're not going to have vaccines until the spring at the earliest. So, things like masks are all we have. And so then suddenly it becomes down to say, we all the focus gets put on masks. And then it becomes like, are you wearing a mask? Are you not wearing a mask? And so on. So, if it was just one part of a really broad, coherent, sensible public health strategy, I don't think that masks would be such a big deal. That's maybe more of a hunch than a real backed up hypothesis, but that's the way my thinking has been going recently.
Yeah, I mean, I think that question of trust is a good point. Like, if we think back to the lockdowns in March, April, May, the point of those lockdowns was supposed to be, let's buy some time for the healthcare system, for the public health system, to figure out what we really need to do to get testing in place and to, get PPE to all the hospitals and all of this stuff and really be ready. But none of that really happened. Even in a city like New York, where I live, where we really locked down and it was really terrible here, we still don't really have quite as much testing as we need. Now, as cases are rising again, there are really long lines at all the testing centers and all of this stuff. So we're still not prepared, even though we went through a really terrible outbreak in the spring. And I definitely think that erodes people's trust, like Pearl was saying.
Well, being at a medical center, I do think we're considerably more prepared than we were in the spring. And I just had a couple of general comments to make. So South Korea is different for a number of reasons. First of all, the culture is slightly different there. They work 6 days a week. They're not as individualistic, at least from my understanding. And their public health system is centralized. Our public health system is quite decentralized. So I live in a pretty affluent county, Nassau County, and our Department of Public Health is terrible. It's got to be among the worst in the country. You can't call anyone. You can't get any information. You can't figure out where to get tested. So the one thing that I felt good about, I have several family members that are primary care physicians, was that people really cared about the healthcare workers. and they cared about how hard they were working, or even the first responders or the essential workers. But now I don't think anyone really cares. And so I've heard nurses get interviewed that they just did a killer extra 12-hour shift, and on their way home they drive by a bar where everyone's sitting there drinking without masks. It's just not fair. And I think if we could sort of make people aware again of how stressful this is on healthcare workers, as well as other first responders, the EMS staff, they were really under stress in March and April. If the public knew more about this, perhaps they would take it more seriously.
Great. So thank you for your insights on that. We're going to switch gears a little bit with a question more about misinformation and how we can interpret scientific information. So given the pandemic, people with no scientific training are much more interested in reading scientific papers. How can a layperson begin to navigate published papers while avoiding misinformation themselves? For example, papers have been published stating that hydroxychloroquine is effective, only to be shot down later for its methodology. So how can a non-expert avoid a paper like that?
I wrote a piece for the Times a few weeks back called How to Read a COVID Paper, I think is the name of it. So if you just Google my name and like how to read a scientific paper, I offered my thoughts there. So I'm just real quick. I mean, I would just say that if people want to read scientific papers to get that kind of information, they have to understand sort of what the scientific paper is as a thing, and they have to understand. They have to spend some time learning about how these kinds of studies work. What does it mean? Why is it that a double-blind controlled trial is better than a small unblinded trial? Why? I mean, there are good reasons for it, but you have to put in the work. So I definitely want to encourage people to learn all that they can, but again, you want to it is very easy to read something and think you understand it, and then actually come away with the wrong message. So you mentioned hydroxychloroquine. There are plenty of preprints that made all sorts of claims about it. The papers that actually got into medical journals and were large, well-powered clinical trials, they didn't see that. So it's the same thing as with global warming or evolution. There's lots of ways to cherry pick a paper, misread a paper to think that it supports some view that actually science doesn't support. But for individuals, there are some good ways that you can sort of move forward and learn from these things. And there, it is true that these papers and preprints are incredibly accessible now. Preprints are free. And a lot of the COVID scientific literature is being made open access. So there's no bar there. Like, you don't need to have some account at a university. So lots of people are reading it. But you can see that I think the worst example of how this goes off the rails is when Steve Bannon pushed a quote unquote preprint that claimed that this virus was engineered in a Chinese military lab. It was carefully worked out disinformation that was cloaked to look like it was science, and it wasn't, and it's done terrible damage. That's the world that we're in, and people need to be aware that there are people who are not using these systems in good faith.
So I think beyond having intentional misinformation, there are two other points. I think scientists should learn how to communicate better. It's very easy to communicate with 10 of your best friends working on the same topic. but communicating more broadly is a requirement right now. And I think there is a burden on the scientist to actually produce well-readable, clear, broadly accessible papers, not only something that is appreciated by a narrow specialist. So that's one thing. Second, the readers must appreciate that science is not so-called godly. Science makes mistakes. Science is dealing with the unknown. When you deal with the unknown, there are mistakes, and the scientific process is explicitly constructed to allow for mistakes and allow for the correction of the mistakes through the research. So that's very important for people to understand that there is an error rate in communication, and if that is not understood, then really bad things can happen.
I think in addition to journalists who write about scientific papers, there are a lot of free resources out there that can help people understand how to engage with this kind of information. I think that's one of the great things about science communication as a field, is that you don't necessarily need to go to graduate school or have some specific training to do it. There's a lot out there just on the internet. One resource that I really like is the Open Notebook, which is an online publication that writes about science writing. They have an article on how to read scientific papers that's really good, and they have other stuff along these lines. And there are also, journalists and scientists who do regular roundups of research. If you don't want to just dig into MedRxiv or some preprint server, it's not hard to find people who are doing this work already and disseminating it in a very accessible way.
Yes, but if you have a bias, for example, you think that vaccines must be bad because that's what your religious leader told you, you can find anything you want on the internet to support it. And so I wonder if there's some way to monitor this or make people aware of the fact that something is not as reliable a source.
Well, people have to pay attention to, I mean, if you're going to do something, put something out, if no one is noticing it, then it doesn't do much good, unfortunately. So there have been, the Public Library of Science and other places have done some great work and saying like, well, how can we flag preprints to give people a sense that this is something good? That this is, it hasn't been peer reviewed yet, but it's strong and sort of almost like a good housekeeping seal of approval, short of actual peer review. And while that's great, they're thinking about like little, the discussions I've heard have had like little icons that, if you notice them and you know what they mean, great, then you can use that as part of your judgment. But we all go to websites and there's like a million things we don't pay attention to on them. So I think that sometimes the scientific community has to, just to follow up on the previous comment, sometimes the scientific community has to do a better job of actually understanding the process of communication, the process of design, the process of putting out information and having people actually pay attention. There is a sort of it's easy when you're a scientist, I think, to say like, here's my data, I put it out there, problem solved, I can go on and go back with my work. And that's just not how the world works. So that's my perspective as a journalist on the outside.
Well, thank you so much for that advice and these really great thoughts about how we can best represent our research. So we do have some questions in the chat that we have to get to. So in the interest of time, we'll move on to those. So feel free to also like type answers to questions that interest you in the chat. But I'll start off by reading down, starting with the earliest one for fairness. So Many have lost trust in scientists after they declared masks necessary when prior it was deemed unnecessary, but this is quite reflective of the scientific method. You have to get things wrong to get things right. So how can we increase awareness about the scientific method to those that are not in the scientific field?
I mean, I think that basic kind of explainer pieces from a journalistic standpoint are really important to that end. As I mentioned when I introduced myself, at Stacker, we're not able to do such a large suite of coronavirus coverage as other publications. So that's one thing we've really focused on in trying to answer those basic questions and explain the processes behind some of these choices. And I think that transparency has to come not only from scientists, but also from public health officials. There's a really great article in Wired recently about how public health officials don't release data or scientific citations behind why they issue, for example, a curfew at 10 p.m. And how that's supposed to stop the spread. And I think being clear about why you're making the choices that you're making and why you're making the recommendations that you're making can help increase trust, in addition to kind of educating people on the basic tenets of how science works.
Well, I think in the past, people were more trusting of what they heard from the CDC or the Surgeon General. And we've sort of decimated that.
Yeah.
It'll take a few years to build back.
I mean, honestly, whenever somebody tells you that quote unquote scientist said, no such thing. Yeah, there are many scientists, they have different opinions. And I'm fairly sure that many scientists never said that masks are not useful. So what does it mean that scientists said something? Every time I hear that, I know it's wrong. Yeah, there is no such thing as the scientist said. There are opinions and there are evidence. People also should have some critical thinking about what people tell them to do. It's not a it's not a belief system. It's about evidence and experience and knowledge. So nature doesn't care about your ideology. It is nature.
Yes, but unfortunately, people care about their ideology.
And that's why we have to communicate very clearly.
So
I think part of the problem with masks was that we didn't have enough of them initially. And so the government made a decision to dissuade people from hoarding them. And now we're paying the price for that.
So thank you for your thoughts, everyone, on that question. But maybe let's just do like one direct response per question because we have a lot of them from the audience. And I would like to get to all of them if possible. So next question from Harrison. With multiple COVID-19 vaccines reported to be 90+% effective in the past week, how do you foresee state and federal governments assessing the two options in administering to civilians?
I can take that one just because I've been reporting on this. Basically, because Moderna and Pfizer are pretty much identical efficacy, and they're pretty much identical in terms of their makeup, their messenger RNA. The only issue will be who will be able to handle the different storage requirements, because Pfizer has to be kept at -94, but they have these boxes that they're promoting. Moderna has to be kept transported at -4, but then it can be kept in a refrigerator for 30 days. So I think that's all it'll come down to. And also production. They're going to be, today, how many thousands of vaccines of each one are ready, and who needs them right today.
It's also the federal government that's paying for them, right?
Yeah, it is. And but this will get more complicated when there are new vaccines that come out. So you could probably AstraZeneca and Johnson & Johnson will probably get emergency use authorization. That would be just my bet. They may have a different profile. We don't know how effective they'll be. They'll probably be pretty effective too. So it's going to get complicated. But right now, it's Moderna and Pfizer are virtually identical.
Great, thank you. So next question from Megan, have any of you heard about the Netflix documentary that was done on Cambridge Analytica? I know it was more about political targeting, but how do you think scandals like that affect our engagement with data and trust in the data we get from the media?
Harms it.
Sorry?
It harms belief. Yeah, that documentary was shocking, and yes, it's harmful.
Okay, so I think we have time for just one last question before we wrap up. Maria is asking, what important insights can we learn from the HIV and AIDS epidemic and the spreading of accurate information about SARS-CoV-2?
So I think that it took a while for activists to get involved and to get scientists, especially at the NIH, sort of involved in understanding what was going on in the lives of AIDS patients. And so in that sense, I think it's quite a bit different because we're not talking about a group of people being infected that we could say that, you know, that's not us. I'm not in that group. Here, everyone's being infected, especially, and everyone has elderly relatives. And so I think it'll be different.
Great, so we are all out of time for this panel. Thank you so much, everyone, for being here and for giving all your great thoughts on questions that everyone had. So I will be handing things back to Aria so that we can move on to the next section of the conference. And thank you again.
Thank you.
Yeah, I just want to reiterate my thanks for all the panelists for coming here today. I know you all have busy lives and busy weekends, so I really appreciate you making the time.